Hello and welcome to my channel. Today I just wanted to do a year 1 medicine review and I'm so excited to do this. Like, this year has gone by so quickly and at the same time so slowly, respectfully. Yeah, I've had a great year. I've learned so much. I'm so proud of myself with how much I've been able to navigate, and especially now having my exam results back, I'm just so happy that I passed. Worked so hard this year and everything has really paid off for me. Yeah, I've just had a great university experience, so I feel so proud and happy to be a medical student, ignoring the current state of the NHS at the moment, but especially for a first year I feel so accomplished and so happy with all I've been able to do. So I wanted to make this video reviewing my first year, just saying all the things that happened and how I felt about it, because clearly I wasn't posting during the year because I was like overthinking. Also, I was a bit worried about professionalism, but I realised for professionalism all you can do is just avoid all patient-centered information and give them full anonymity, so that is not going to be an issue for me. Overall, the year went great. I have to say though, I was definitely stressing myself out too much. Like, obviously being a medical student is one of the hardest degrees you could do, you know, apart from maths and things like that. Yeah, there was so much to learn, but I really just put it in my stride and just found myself enjoying everything that I was learning, which definitely made it so much better because it was like I was kind of searching for information and just trying to help myself understand it. So obviously, to begin with the academics, this year in first year we did respiratory, cardiovascular and gastrointestinal, as well as the core science principles. And I can't lie, during all the blocks there was definitely a big learning curve, and just like having the lecture and then realizing that that's it, like that's all you're gonna learn and you need to just literally understand everything from that, especially with antibiotics and things that are really important. It's like you're taught it, so they've taught you it, it's going to be in the exam now, and you just need to like make sure that you fully understand it yourself. So there's definitely a lot of self-directed learning, and luckily for my medical school most of our afternoons were a bit more free, or it would be like a different kind of thing, it would be a seminar or a workshop, something like that. So it was really good to kind of just have that 9 to lunch and then something after lunch. The daily experience was actually quite long when you think about it, because you're always trying to retain what you've learned. I'm trying to do active recall and spaced repetition, so it was quite draining just thinking I always need to go over this, I always need to go over that. In the day-to-day life it really did feel like there were so many lectures, and I have to say, obviously for myself, I went to every single lecture. I'm not joking to you, like I went all of the lectures in person, online, everything, and in hindsight that was definitely a long experience, but I suppose just having them speak it to you was quite helpful. And then when it's just a recorded thing, it's like, what am I paying my money for, I suppose. But people in my class definitely didn't go to all their lectures and they clearly did well as well, so maybe next year I'll be trying a little bit more of a mix. But I can't lie, my attendance must have been 98%. With the online lectures, it does take away that stress because you can kind of watch on 2 times speed, you can do 2 things at once kind of and just get your work done a bit faster, and that does work for quite a lot of people. I'm really glad and proud of myself as well, just for putting in that effort and really attending everything that I could. But it really did feel like there was a lot of lectures, but at the end of the day we're learning medicine, so there's a lot to learn. So moving on from that, placement. I really did enjoy placement. Obviously I worked as a healthcare assistant for a long time before, so it was really good to actually be able to do medical things, like doctor things, instead of just like, you know, taking blood sugars and blood pressure, which I definitely did as well on placement. But it was just amazing for me to kind of have that confidence with the patients and actually be able to ask them the questions I was really thinking. I also wrote my reflection about this actually. The first time we did history taking, I was shocked because of how long they take, like in respiratory, asking how many pillows they have to sleep on, how far they can walk, how their cough is, the characteristic of it. It's just so interesting to me just to be able to get to that doctor level of communication, just asking so many questions that you don't usually get to ask. And I really did appreciate the patients being so honest with us and just really bearing their lives. Even with issues like drugs and alcohol, we got to breach that even as a first year medical student, so it's really amazing to have such honest patients. So we had quite a lot of placement in first year, and I did quite enjoy that because we also had teaching from fellows, like showcasing how they've learned and how they're working, and now they're moving on to their training. So it's really nice to just kind of see that, like, or see yourself in them. And we also had GP placement, and I think this is really great because the GP we had was such a lovely man. He had such great patient manner, And especially with all the news recently, he was just a shining example of a great GP. Thoughtful, he'd always be referring, he'd really listen, he'd give patients extra slots, and it was just amazing to see. And of course the patient demographic was so interesting, like you see from babies to really old people, and even seeing like death certificates. It was actually amazing. And just the knowledge that our GP had was so impressive. Again, in GP, even getting to examine patients and taking histories from them as a first year was just amazing. The teaching fellows and consultants we had said that we were just like so amazing, and like they were surprised that we were first years. So I think it is great to have a lot of clinical experience in first year. So this time last year I actually left my full-time job as a healthcare assistant, but I've been working part-time, and it's just been amazing for me as well, just to now have that same job but a different perspective. Now that I know all the medications, I know all the procedures. I've got to see in surgery, I got to see a coronary artery bypass graft, and that was amazing to see how fast the surgeon was suturing and just their technique. So now I'm just going to move on to the more social side, talk about societies. So obviously I was part of Christian Union Society, which was so good for me, and to be honest I did go to quite a lot of Christian events, and I'm glad that I was able to dedicate that time, even though there were so many days that I was thinking I'd rather be in the library right now. But yeah, it was just good to kind of have that community, and we also got to explore quite a few churches in the area. And it was great to see just a different vibe from my home church, you know, and just the community there was like thriving as well. So then the medical societies were also great. We had so many events, we had balls and boat party, and obviously I don't drink, but still I had a great time. Academic societies like plastic surgery, they had amazing events. Like I got to do tendon repair on a cadaver, like literally it was such an honour. So we got to learn the techniques from the consultants and sew them up again, and we also got to do Z-flap repair. So that was an amazing event, and I've had so much experience suturing already, which again is amazing. So yeah, I've really been enjoying the societies, and next year I will be president of a society. Now I'm going to move on to the friendships. I made loads of friends. My cohort is quite small, but yeah, it's just nice to have everyone as a friend. Like you kind of know everyone, especially with clinical skills and anatomy, you get to know everyone. But yeah, I've made some great friends, and it's just lovely to think that we'll all be doctors at the end of this. And I also wrote down my flat. Shout out to my flat, they were really fun, and my room was so nice. It was so nice to have your own space, and I'm really glad that we managed to keep the kitchen clean. Like I was actually vigilant about that, and my flatmates slayed. Like we'd all keep it really clean, and it was just a nice environment to go home to. We'd always in the beginning we'd always go to lectures together, and it was just so sweet to have that kind of like safe place, I suppose. Though I have to say, I was going home. Any inconvenience, I was going home. I was on that train home. Yes, thank you very much. And I've definitely given Trainline like hundreds of pounds at this point, but I'm really just glad that I'm not that far away, that I can just get the train at any inconvenience. And especially because we had online lectures on Friday, on Thursday I'm going home, like respectfully. And I just really thought that was such a joy, because I got to see my family, and it just kind of helped me to realise how close I am with my family. Like some people were not, and it's quite sad, but yeah, it was lovely to just come home, you know, get my washing done, just have all of the privileges that come with being at home. So I'm just so glad that I could do that. And the last thing I wrote was money. So my student finance was not giving, and I'm so glad that I could work all those months so that I didn't really have to suffer. And I think for me what was good is just to like accept that cost of living crisis, everything's expensive. Don't let yourself stress out too much. If you want those grapes, get the grapes. And yeah, it was just so crazy, like seeing the prices increase. It was crazy. And like one thing about my friend, like they're deal hunters, you know, they're gonna get that student discount, they can get that code. And I realized it's good because every penny counts at this point. Year one was so stressful when I was experiencing it, and so stressful when I was just like worrying about the exam. But looking back, I'm so proud of myself for how I managed everything and how I was so dedicated. And yeah, I'm just so excited for the next few years that to come. And I can already tell how medical school can go by so quickly, and then suddenly you're a doctor. working so hard. Please excuse my voice, as you can tell I've been so ill, but I really wanted to film this and just give a good message about how I've been. Like throughout the year I was actually a bit militant, like I was not watching any Netflix, I deleted Instagram, I was doing a lot, and clearly it paid off. So yeah, I'm just really proud of myself that I can be in this position now and not be worrying about resits or worrying about anything. I've done so well and even outdone what I thought I could do. So yeah, thank you for watching this. Thanks for watching this. I'll see you in my next video. Bye!